Hello, and welcome to the Clinical Care Options Infectious Disease podcast. I'm your host, Jennifer Blanchett. In today's episode, Dr. Claudia Cortes from Chile and Dr. Beatriz Grinstein from Brazil share their thoughts on the current status of HIV prevention strategies in Latin America, including recent successes, new implementation data, and ongoing challenges. For more information about our guests and for additional online education on this topic, please visit the link in the show notes. So now, let's turn it over to Dr. Cortes and Dr. Grinstein.
Hi, Dr. Claudia Cortes. It's really a pleasure for me to be with you here in this podcast for clinical care options. We will discuss topics related to PrEP availability and what is new on PrEP for the last year, mostly. And we will focus our discussion in issues related to PrEP that are most important for our region, Latin America. So it's my great pleasure to have this opportunity to have this conversation with you.
Hi, Beatriz. For me, it's also an honor to be here, and I'm very excited to tell everybody and to share our experience of how we handle PrEP and all the difficulties we have in the implementation of PrEP here in Latin America.
So as we all know, despite the major advances in treatment and also in prevention, the HIV pandemic continues to pose a major global health challenge to all of us. And the HIV epidemic, of course, disproportionately affects key populations in the different countries and in the different regions and locations. And so for our region, key populations, young MSM, transgender women are highly affected. So in the past decade, although we have seen decreases in new HIV infections in other regions, these decreases have been much smaller in our region. And in fact, the number of HIV infections have been flat during that last decade in Latin America. And unfortunately, even with this major need to expand PrEP in our region, the expansion of PrEP has been very slow and much slower than we would like to see. And we have also seen that this expansion has been more limited to some countries. Other countries, despite the major need, are being slower in implementing public health policies on PrEP, because we understand that only as a public health policy, PrEP can be really the population's most in need.
I believe, Beatriz, that the problem in our region is that just very few countries have a national program of PrEP availability or PrEP access. And we know that after 3 years of COVID pandemic, the testing is very low. So that is one of our main difficulties to get PrEP. First, you need to rule out that you're HIV positive. And that's been our first problem, at least in my country, in Chile, because the testing is very scarce and there's a lot of difficulties to get tested. But also, I believe that for many countries, PrEP, it's not a priority. They don't understand that you can improve what the pandemic it's evolving if you distribute PrEP more broadly. And just very, very few countries in our region have PrEP programs. In Chile, for example, it's only in some very few hospitals around the country, but it's not covering all the population. I know that there are few other countries that have these preliminary programs. They're testing how it's going to work. But I know that you in Brazil have a more broader access to PrEP in there. So maybe you can share with us your experience in a huge country with a lot of need of PrEP, how things are going on.
Yeah, so thanks, Claudia, for the opportunity to discuss more about the Brazilian public access program to PrEP. So since the end of 2017, we have been implementing a public health program on PrEP access with the daily TDF FTC. At that time, we have done a mathematical modeling exercise that showed that based on the number of individuals that would be under higher vulnerability to HIV infection, we expected that during the first year of PrEP availability, we would have 60,000 individuals initiating PrEP. And as it's very interesting to see how these mathematical modeling exercises can fail, because as of last month, we have 47,000 people on PrEP after 5 years of the program existence. And although we have almost 600 delivery places throughout the entire country, Brazil is a continental country, and we were able to establish 566 delivery points throughout the country. Even though we have all this availability of the drug, multiple services are making it available throughout the country, we still have only almost 47,000 people on PrEP. And the majority are MSM, only 3.8% are transgender women, and the majority of them are between 25 and 39 years old. Although the majority of new infections in Brazil occur most in the younger, mostly up to 29 years old, the PrEP users are higher in a bit older individuals, most of them white. But still, we are improving in PrEP access among the Black individuals who are also at higher risk of HIV infection and AIDS. So we are expanding among the more vulnerable, but it is much slower than we expected to be. Of course, during the last 4 years, due to political reasons, we have not been able to do big campaigns to expand PrEP. But we do hope that now we will be able to make big campaigns expanding the knowledge about PrEP. And of course, you know that the more we increase community education, the knowledge about how to better understand the risks that you are under, you may expand PrEP use. So in a more gender affirmative care environment, we will certainly be able to expand PrEP uptake.
Yeah, what you mentioned, I believe is very interesting, and it's something that unfortunately happens a lot in our region, in many of the countries of Latin America, is that politics that don't recognize and actually they discriminate many of the users of PrEP. We know that PrEP is useful in very young people, especially MSM, transgender, sex workers, female and male sex workers. And those population, those people, most of the time in Latin America need to hide because they be on risk. We know that unfortunately Latin America, the age of survival of transgender is around 35. So this population that will receive more benefits of using PrEP, most of the time they cannot show up and say, okay, I am a transgender person, I would like to take PrEP. And in Latin America, that's a big problem. And I'm so happy to hear that at least in Brazil, that as you mentioned, is a huge country with an important population of trans women. Now they will access to PrEP.
Yes, but thanks, Claudia, for bringing the aspects related to transgender women, that it's such an important topic for us. 75% of the LGBT people killed in Brazil are transgender women. And so it is really very important for us that we can talk about the vulnerabilities and educate the population so that they can use what is available through the public health system to protect themselves. Because transgender, they face many structural barriers, including inadequate legal protections against discrimination, food insecurity, income, and this disproportionately contributes to the burden of HIV among transgender women. And unfortunately, PrEP expansion among them is really fraught. And we did a specific study of PrEP on transgender women that is called the Preparada study that has been recently published at the Journal of the International AIDS Society. And what we saw is that this study we provided PrEP to transgender women in a gender-affirming environment. And although we could see a very good engagement, we had 85% engagement at week 48, what we saw is that actual adherence measured by the levels of tenofovir in plasma were low. So although they could be engaged in the service, actual PrEP use was low. So there are many barriers that are subtle and that are very important for us to understand so that we can provide strategies for these populations for better adherence. We have also the ImPrEP study that the results were very recently published in December in the Lancet HIV. This was a large implementation study that was done in Brazil, Peru, and Mexico, and this can be a proxy for countries that have the same kind of concentrated epidemic in the region. And in this project, we have done a same-day strategy. So individuals who came and were HIV negative, willing to use PrEP, could initiate PrEP same day. And we saw very interesting results, but all of them related to long-term engagement in PrEP and adherence. We saw that younger individuals with lower education had the poorer outcomes. So all the outcomes that we assessed, PrEP abandonment, PrEP engagement within a year, PrEP adherence, and seroconversion. So we understand what are the structural barriers. The problem now is how to act and see how best we can provide strategies for people to really be able to engage. So I think an important message is that availability of the drug is an important point, but it's far from being the only one.
And we have been talking all this time only about oral PrEP, FTC, TDF. But we know that in our region, injectable long-acting cabotegravir that we already know that is extremely useful and actually has been a more high rate of success because the implementation, even you have the barriers of an injection and you have to get that injection frequently, but so far it's giving very good results. But again, we have the problem that Latin America is not a region that is very interested for the pharmacy to distribute this long-acting. And what happened all the time in Latin America that I always say more or less the same sentence, that we're not poor enough to get a lot of support, but we are not rich enough to buy with our own money or our government's money. So there is a huge barrier for PrEP, oral PrEP in general. We can see that long-acting injectable PrEP is going to be more difficult. And probably, unfortunately, our region is going to be the last to get it. We also have other difficulties for long-acting that I don't know if you have information, Beatrice, on how we can deal with that. For example, what happened with the silicone that many transgender women, for example, use, and we know that this is an injectable that needs to be in the buttocks, and with this silicone there is a problem. On the other hand, we know that there is no relevant drug-drug interactions with transition hormone therapy. That is also a very good thing. So in this population, that will not be a problem, but we need to deal with the injections. But I believe that those are secondary problems. We need first to have those drugs and the distribution and all the logistics that long-acting needs.
Yes, thanks, Claudia, for bringing up the important points about injectable PrEP. I think it's really a major advancement. We have already available the results from the 2 phase 3 studies, HPTN-083, that assessed injectable cabotegravir among MSM and transgender women, and also HPTN-084, that was a sister study, assessed the benefits of injectable CAB among young women in Africa. And the results for MSM and trans women show that injectable is superior to TDF-FTC in regards to the effectiveness of the strategy. And for women, the results are even more powerful, almost 90% superior to TDF-FTC. So talking about the characteristics of the populations who are more vulnerable and that have worse outcomes in oral PrEP in our region, such as trans women, as young MSM, and with lower schooling. And so this would be the ideal candidates for an injectable PrEP strategy. But as you said, although we have very good results on efficacy, the true effectiveness in the field is to be seen if we are able to implement this drug. So the first point that you already touched is the point of us not being poor enough to get help from the outside and rich enough to really have the money to implement these strategies, because certainly this will be more expensive than TDF-FTC that is already not enough implemented in our region. So there is a lot ahead of us in regards to the barriers that we will need to overcome to implement CAB-LA. But it is already submitted for some health agencies in the region. CAB-LA is already registered in the FDA. It's already registered with the South African agency in Zimbabwe and also in Australia. And Brazil is one of the countries where it is submitted for more than 1 year already. So despite the great results, the speed of the reviews are not as good as we would expect them to be. So there are issues related to where would be the best places to implement CAB. But definitely for people who deal with adherence problems, this can be a very good strategy. Of course, people will need to deal with adherence to injection visits. And this is something that we will really need to study about. And we are about to start an implementation study on CAB in Brazil that will happen in 6 public health sites that are already oral sites across the different regions in the country. And we expect that this project will provide us with information on how best to implement this new strategy within the public health system in Brazil, and that this could also provide important information for other countries in the region to help to structure injectable PrEP programs across Latin America. I think that it's good news that we presented in the last AIDS conference in Montreal last July about the lack of interaction of hormones, so that is very reassuring for the transgender population. For years, there was this debate about the influence of hormones on PrEP efficacy among transgender women, and this was really another layer of complexity for this so vulnerable population to adopt PrEP. So good news is that for CAB, so far the information we have is that there is no interaction on cabotegravir. But regarding silicone, that was the aspect that very well you brought. Unfortunately, the injections are done in the gluteus region, and we know that there is a broad use of silicone in the trans communities. And unfortunately, these injections cannot be given when there is silicone in the gluteus region. But there are studies ongoing. There was a study presented at AIDS 2022 in Montreal for healthy people. It was testing the injection for treatment, that cabotegravir rilpivirine, and the injections were done in the external tight region. And the PK results were good. More results on this will be presented in next conferences, advancing the knowledge. And we do hope that this can be promising for the trans community. But so far, we don't have specific data for PrEP, but this is a major area for research, because we do understand that we need to provide other options for cabotegravir long-acting injection for the trans community, as silicone use is an important topic for them.
Yeah, but I want to say that I believe that it's fantastic that you are going to run this study of cabotegravir long-acting in Latin America, in Brazil. So that's going to be a way that this fantastic strategy can come into the region. But for now, I also look at this in a very faraway perspective because of the cost, probably. So for now, we have oral PrEP that is very, very good too. But for now, in our region, we must make to our governments and our Ministry of Health of all the countries to understand how important it is to give access to PrEP. Also, that goes hand by hand with formation, with education, with the accessibility of HIV testing that is a difficulty in some countries. And in that way, we can use PrEP that at this point, we have so much strong evidence about how useful PrEP is to prevent new HIV cases. So from my perspective, from Latin America, we now need to focus on oral PrEP and how to get access to that.
Yeah, I couldn't agree more with you. I think that we have a very powerful tool in our hands and that we need to work with each of us who are activists and physicians, researchers working with HIV. We need to work with our governments to expand PrEP use and work on strategies to try to overcome the important structural barriers that avoid oral PrEP expansion among the most vulnerable populations. So we have a lot of work to be done to expand oral PrEP use in our region, but we do need to target the most vulnerable because unfortunately, the expansions that have been done are mostly among people who can more easily access PrEP, but we do need to work to make it more available and sustainable among the most vulnerable individuals.
Yes, thank you, Clinical Care Options, to give us the opportunity to share our experience and our challenges here in the region about PrEP, because probably this is also the reality that in some places in Asia or in Africa, they are dealing with more or less the same situation than us. So thank you, Beatrice.
Thank you so much, Claudia. It has been great to talk to you, and thank you to Clinical Care Options for the opportunity to have us.
Thank you, Dr. Cortes and Dr. Grinstein, for sharing your insights with us. And thank you for listening. Look out for more episodes in this series at clinicaloptions.com/HIV.